ते 5 मिनिटं ते ठेवणार, बाकी हेच ठेवणार. Good afternoon. After a long time, now you have given the test. I would like to summarize few things about this test. Overall, 194 responses I have received out of 213, and average is around 35 out of 50. So that is very good. Median is 36. So overall, your performance is good. Some question I would like to revise, because in that the percent of correct answer were less than total number, less than half of you. So first question, a 25-year-old man complained of cough with sputum for last 6 months. X-ray revealed a cavity in upper lobe of right lung. He is probably suffering from, as cough with sputum is for 6 months and there is a cavity in the upper right lobe. Two things will suggest it is secondary tuberculosis. One is upper lobe of right lung, means it is not the in the middle zone, and therefore it is likely to be secondary, and because it is a cavity and therefore it is more likely to be secondary tuberculosis. Lung abscess may give this type of cavity, but generally patient may not be suffering for 6 months. Bronchiectasis will not be giving that big cavity to be called as cavity, so it is secondary tuberculosis. Second question, acute myocardial infarction, LDH level reach a peak in 24 hours is the correct answer, not the 3 days. So it is first one to arise after myocardial infarction in the serum. Next question is almost many of you have given correctly. I will not be discussing. Next, flask shaped ulcers are seen in that, also you have correctly given. Which is the following pathogens? Most of you know that renal cell carcinoma may be associated with all of the following except that you know leukopenia. Some of you have given the muscularization or polycythemia. This question I would like to discuss because this is question related to paraneoplastic syndrome. So which type of paraneoplastic syndrome may occur in a renal cell carcinoma? Depending on various types of hormones it may produce, and because of that polycythemia, hypercalcemia, muscularization can occur, but leukopenia will not be occurring because of this paraneoplastic syndrome. Commonest cause of aneurysm, most of you know. Earliest serum marker of HPV infection is HbACG, that you know. McCallum's plaques caused by rheumatic carditis, it is seen in rheumatic carditis, that you know. Classical example of anti-GBM nephritis is good posture syndrome. Good. Commonest renal tumor in adult is renal cell carcinoma. In children it will be Wilms tumor. In atherosclerosis, commonest site of involvement is abdominal. Primary complex may occur in following sites except heart, that is correct. Skip lesions in intestine is term applied to lesions of Crohn's disease, that is correct. Connectedness in neonatal jaundice is due to unconjugated bilirubin, that is also most of you have given the answer. Crescent formation in arpeggian is due to proliferation of parietal epithelial cells, that is important, and most of you know that. Major criteria for diagnosis of rheumatic fever, that many of you know. chronic ulcerative colitis does not show one of the following features. So transmural inflammation is not seen in ulcerative colitis. COPD includes the following entities except empyema. Empyema is basically pus in the pleural cavity, and therefore it is not part of COPD. Clinical signs of liver cell failure include all of the following except that most of you know that malar flush. So you know the features of portal hypertension, and therefore malar flush is not part of that. So that is correct answer. Pneumocystis carinii pneumonia is associated with all of the above. So AIDS, cytomegalovirus and leukemia, in all three cases it will be there. One of the following is not common statology of folate, that also you know. Micronodular cirrhosis is not seen in, many of you know that it is post-necrotic cirrhosis. In hemochromatosis, in childhood cirrhosis, alcoholic cirrhosis, micronodular may occur. Basically in alcoholic cirrhosis, mixed cirrhosis is more common than micronodular, but micronodular may be seen. But in most post-necrotic cirrhosis, generally there will be micronodular cirrhosis. Extensive subepithelial deposition leads to thickening of glomerular basement membrane in membranous glomerulonephritis. Not all of the above. So crescentic glomerulonephritis, basically that irritation is occurring in the near the parietal epithelial cells. So it is urinary space where the irritation and inflammation occurs, which will be followed by this irritation occurs because of mainly the fibrin reaching the urinary space, and then this parietal epitheliums will be activated along with the macrophages. This will be crossing crescent, and therefore crescent glomerulonephritis is not correct answer. Post-streptococcal glomerulonephritis, the post-streptococcal glomerulonephritis, there will be subepithelial deposition, but thickening of basement membrane will not be seen over there. In a light microscope, you are going to see the thickening of basement membrane in the membranous glomerulonephritis. So it is few of you have given the answer. Another complaints, a mother complains that her 10-year-old son is not eating food properly and is lethargic. He is passing high colored urine. The boy had attended a party 2 weeks back. On examination, there is pain in right hypochondrium. The probable diagnosis is, most of you have written hepatitis A, and that is correct because it is 10 years old and the transmission appears to be through the food, and therefore likely to be hepatitis A, and it is common in because of this oral transmission. Atyl nitriuretic factor has following effects except, most of you know that it is potent diuretic. It neutralizes the effect of renin-angiotensin system, and it causes natriuresis, and therefore the causes of and it actually not causes prostaglandin secretion, but it is inhibits it, it competes with it, and therefore it is the correct answer. Peptic ulcer does not occur at upper end of esophagus. That is correct answer. Many of you know that peptic ulcer is basically ulcer occurring anywhere in GI tract in response to the acid secretion by stomach. So wherever this can reach, acid can reach, it may cause it. So generally upper end of esophagus, duodenum it can cause, it can gastroesophageal junction and duodenum it can cause. Meckel's diverticulum, there might be the ectopic rest of this gastric mucosa, and therefore it may cause. And upper end of esophagus, where the squamous epithelium is there, and generally there will not be peptic ulcer occurring over there. So upper end of esophagus is correct answer. Bronchogenic carcinoma usually do not secrete growth hormone. So most of you have given it. So it is again paraneoplastic syndrome, which what we are discussing, and here growth hormone will not be occurring most of the times. Very rarely it may occur. So it is the single best answer. Thyroidization of renal tubules is seen in, yes, it is seen in chronic pyelonephritis. It is not actually thyroid hormone present in the means thyroid tubules are present over there, but it is the protein matter present in the tubules which may appear the microscopic picture as thyroid, and therefore it is called as thyroidization of renal tubules. Following complications of bacterial endocarditis are due to immune complex formation except arthritis. See, arthritis is related to antigen antibody complex deposited over there. Subungual splinter hemorrhages, that also indicate vasculitis, and that is again immune complex deposition. Cerebral abscess is nothing but a abscess, means it is infection. So it is not immune complex deposited over there. Some type of infection has gone from the heart to the brain, and therefore cerebral abscess has occurred. So that is correct answer. Purpuric spots, again the indicating the vasculitis. Following are true about Gilbert's disease except it is mild jaundice. Yes, it occurs in the Gilbert's disease. Unconjugated hyperbilirubinemia is there because it is not converted. Autosomal recessive, it is generally not autosomal recessive. It is normal liver biopsy will be seen in the microscopic appearance, and therefore it is 2. So it is autosomal recessive nature is the correct answer. Bronchial asthma is mediated by immunoglobulin. Almost all of you know that it is IgE. Good. The commonest site of gastric cancer is pylorus and antrum, cardia, gastroesophageal junction, and body. Most of you know that it is pylorus and antrum. In myocardial infarction, neutrophils appear around the infarct within less than 4 hours, 6 hours, 8 hours, 12 hours. Less than 4 hours, you might think about it because it is inflammation, it is occurring acutely, and therefore you may think it is less than 4 hours. But after infarction, when there is secondary changes start occurring, thereafter the process of inflammation will start. Initially it is infarction, no necrosis is seen, and therefore to develop means changes in myocardial to occur, it will take around 4 to 5 hours. So within 6 hours, around 6 hours, there will be neutrophils will be reaching the site, and therefore 6 hours is correct answer. 12 hours is slightly too long, which most of you have given. The type of emphysema associated with alpha-1 antitrypsin disease is, that is paraseptal, pan-arterial, irregular, and centrilobular. So pan-arterial is mainly related to alpha-1 antitrypsin disease. Insulin resistant is feature of all except IDDM, where insulin is secretion is low, and therefore the diabetes is occurring. So it is IDDM is correct answer, not NIDT. Primary small granule contracted kidney is characteristic of all of the following except RPGN, benign nephrosclerosis, chronic glomerulonephritis, chronic pyelonephritis. Here, all types of chronic, it is word already been used. So it is small granular contracted kidneys occurring generally in chronic phase. So these three are main causes: benign nephrosclerosis, chronic glomerulonephritis, and chronic pyelonephritis, and they have to be differentiated anytime you get small granular contracted kidney. RPGN, generally there might be large white pale kidney. Leather bottle stomach results from which type of carcinoma stomach? So gross appearance, when there is diffuse infiltrated type, it is leather bottle appearance will be there, and therefore that is the cause. Ulcerated type, there will not be leather bottle appearance. Polypoidal, the protrusion will be there. Fungating, again a mass will be protruding inside, and so it is not leather bottle. So diffuse infiltrating type is the cause. Staghorn calculus in renal pelvic system. Yes, most of you know about it, that it is magnesium ammonium phosphate, triple phosphate, which occurs because of mainly the production of ammonia, breakdown of ammonia by the various organisms, mainly Proteus. Which is the following factor does not predispose to bacterial endocarditis? Many of you know that it is hypertension, because catheterization, intravenous injection, post delivery, there is chance of infection, and that may cause septicemia led to bacterial endocarditis. So infection which occurs because of catheterization, intravenous injection, and post delivery, and therefore hypertension, where the chance of infection does not increase by itself, and therefore it is the correct answer. Hayman nephritis is well established model of, yes, good, most of you have given membranous glomerulonephritis. So it is the rat model, which we have seen that from rat the tubular epithelium is removed and re-injected in rabbit, antibodies received from rabbit re-injected in the rat, and we see membranous glomerulonephritis. So that is Hayman's nephritis, and it is example of membranous glomerulonephritis in human beings. Which type of lung cancer has worst prognosis? So small cell carcinoma has worst prognosis, that, and therefore it is now classified as small cell carcinoma and non-small cell carcinoma, and therefore it is important entity, small cell carcinoma. Carcinoid tumors originate from mucosal epithelial cells, mucosal endocrine cells, mucosal lymphocytes, mucosal blood vessels. So it is occurring from endocrine cells. So carcinoid occurring in lung or GI tract, it is present in the epithelium, but the cells originating are endocrine cells, which may produce cyanotophysin, 5-HT, etc. It may produce. About nephritic syndrome. Presentation with oliguria and hematuria. Yes, that is the part of definition. So it is the reason. Diffuse effacement of food processes. That is not part of nephritic syndrome. It is part of nephrotic syndrome, where there will be increased loss of proteins, high protein loss. Presence of hypoalbuminemia. So it is secondary to loss of protein. Hypoalbuminemia may occur, and so it is not part of this answer. Presence of massive edema and anasarca, again following loss of large amount of protein. So because loss of large protein is not associated with nephritic syndrome, these three are not present, so presentation with oliguria and hematuria is the correct answer. Lipoprotein most often associated with heart disease is very low VLDL, chylomicrons, low density lipoproteins and high density lipoproteins. LDL and VLDL both are considered bad lipoproteins, but generally LDL considered more bad than VLDL. So low density lipoprotein is correct answer. A mushroom shaped exudate with ulcers in the colon is characteristic of ulcerative colitis, collagenous colitis, pseudomembranous colitis and gangrene. So it is seen in pseudomembranous colitis. Because of that, because of this type of is called pseudomembranous colitis. Skin and hypogonadism. The likely diagnosis is Wilson's disease, alpha-1 antitrypsin deficiency, Addison's disease, and hemochromatosis. Here, it may not be too clear for you because the lesion has not been specified where it is occurring. If you know that it is occurring in the liver, then you will be able to identify more correctly, that is hemochromatosis. A 40-year-old man presented with constipation of low-grade fever, weight loss for 2 months. X-ray chest revealed opacity of right upper lobe of lung involvement of ileocecal region may reveal all of the following except transverse mucosal ulcer, caseating granulomas, oval mucosal ulcers, transmural involvement. When a mass is occurring in the ileocecal region, it may be tumor or it may be tuberculosis. When you have been given history of X-ray chest revealed opacity of right upper lobe, it indicates basically either it is again the tuberculosis firstly, and secondly it might be secondary in the lung. But when you see options transverse mucosal ulcers, caseating granulomas and transmural involvement, these indicative of tuberculosis rather than the malignancy, and therefore oval mucosal ulcers, which will not be seen in the case of tuberculosis, it will be correct answer. Kaplan syndrome consists of silicosis and tuberculosis, pneumoconiosis and rheumatoid arthritis, byssinosis and rheumatoid arthritis, asbestosis and tuberculosis. Here basically coal deposition and rheumatoid arthritis are present. So it is pneumoconiosis with rheumatoid arthritis is the correct answer. Barrett's esophagus is characterized by all except lower esophagus is lined by columnar epithelium caused by Helicobacter pylori, predisposition to adenocarcinoma, patient complains of reflux. Here in Barrett's esophagus, basically there is alteration of squamous epithelium to the columnar epithelium is not it is the correct it is part of Barrett's esophagus, so it is not the correct answer. Predisposition to adenocarcinoma occurs because squamous epithelium is converted to columnar epithelium, which may produce adenocarcinoma. So intestinal type of metaplasm may occur in Barrett's esophagus leading to adenocarcinoma, or stomach, both may cause adenocarcinoma. Third is patient complaints of reflux. Because of that reflux only this Barrett's esophagus occurs. So it is not the correct answer. So it is Helicobacter pylori, which may cause peptic ulcer, but it does not cause Barrett's esophagus. Means it may increase the production of some amount of acid, but rather than acid, it decreases the mucoid layer on the stomach epithelium, and therefore it may be vulnerable for this acid damage, and it may increase the secretion which may reach there, but it by itself directly it does not cause Barrett's esophagus. So it is the best response. So this covers all the questions. Congratulations to all of you for giving good answers. I'll be sending you the responses shortly. Thank you and best wishes.